Medicare is a large public intermediary in the U.S. It covers essentially everyone over age 65 and also covers the permanently disabled and people with end-stage renal disease, kidney failure. So it covers a large and important group within the population, including some of the people that need the most medical care. Medicare is run by a government organization called the Center for Medicare and Medicaid Services, which goes by CMS, so you can hear that acronym floating around the U.S. healthcare system a lot. Medicare is largely tax-financed, and this pays most of the costs. People eligible for Medicare can enroll and do have to pay some smaller premiums usually, but most of the cost of Medicare comes from the population overall in the form of taxes. Medicare has some different structures within it with different options that we have to take a look at if we're going to understand something about how it works. First of all, we have traditional Medicare, the original, as set up in 1965 when Medicare first came along. Sometimes people call this Part A and Part B because when originally set up, and in fact still today, there was one part of Medicare that covered hospital care, Part A, and another that covered physician care, Part B. Though they still technically exist as separate things, nearly everyone who gets traditional Medicare gets both as a package, so we tend to think of them as a pair, making up one single insurance plan. Traditional Medicare offers basically traditional coverage, just as it was built in the 1960s. It's got an open panel, beneficiaries can go to more or less any doctor or hospital in the U.S., and it has little utilization review, no gatekeepers. It pays doctors using a fee schedule and hospitals using a DRG system. It has pretty generous coverage. Most things are covered by Medicare. In fact, Medicare is prohibited from excluding services from coverage on the basis of cost, so that doesn't happen. Traditional Medicare does have pretty high cost sharing though. For example, with deductibles for hospital care and 20% coinsurance for patients with physician visits. Traditional Medicare is the most popular option chosen by Medicare recipients, but a second option has been gaining. In this option, which we call Medicare Advantage, or Medicare Part C, Medicare contracts with private insurance companies to take Medicare enrollees. These are often the same plans that operate serving people under 65, though there are some private plans that have made a strong focus on just the Medicare market. The private plans can sign up if they want to be able to take Medicare beneficiaries, and there are some requirements like they have to offer benefits that meet Medicare standards. Then Medicare has some structures in place to determine how much Medicare will pay a plan to take a beneficiary if one signs up. Essentially, Medicare makes a deal with the plan to pay sort of a premium to take the beneficiary. Beneficiaries then get a choice. They can take traditional Medicare, or they can opt to be in a Medicare Advantage plan, a private plan contracted with Medicare. They might be in an HMO or a PPO or similar under the Medicare Advantage arrangement. One of the criticisms of Medicare as originally set up was that it did not offer very good coverage, or any coverage really, for some prescription drugs. And so an additional part was added, Part D, which is an additional piece of Medicare for people who want to get prescription drug coverage. We'll use the version of Part D that goes with traditional Medicare as our example here. There's another variant that goes with Medicare Advantage. Here, people in traditional Medicare can choose from a menu of options arranged by Medicare. These are all private plans that have set themselves up specifically to cover prescription drugs as an add-on to Part A and Part B. If beneficiaries like, they can go buy the coverage and pay an extra premium themselves to get it. A further criticism of traditional Medicare coverage is high cost sharing. So many people with traditional Medicare get additional private insurance to specifically help with cost sharing and some other things that might not be covered. This is usually called a Medicare supplement or Medigap coverage. Sometimes these are provided by employers as part of a retirement benefit for workers, but often enough people buy them on their own. Medicare also has very limited coverage for long-term care, so that can be an issue, and some people buy additional private insurance for long-term care specifically. So that's a quick overview of components of Medicare. Medicare is not a bad example of a public intermediary and the challenges they can face. Medicare was set up as a public intermediary to solve a public problem that older people, retirees, were not well served by the private insurance system that often operated through employers. And it's evaluated and it responds to this mission. The people who run Medicare, and the government more generally, need to maintain support from its various constituencies, which involves keeping its costs under control and keeping beneficiaries and providers happy, or happy enough. So Medicare has had to vary its operations and plan designs to accomplish this. Medicare, over time, has been very innovative in key areas trying to achieve this. like acting as a pioneer in the creation of fee schedules and DRG systems, and more recently in encouraging the development of ACO models. At the same time, it's faced some criticism for allowing too much choice and what some people think is an outdated traditional insurance model in Parts A and B. But part of the reason it does this is because its beneficiaries like the flexibility. And at the same time they're keeping that, they've been building Medicare Advantage, which brings in newer plan designs, evolving its approach to meet its mandate. Medicare also offers good examples of interactions between private and public intermediaries. Sometimes you see governments contracting with private plans to provide coverage, as in Medicare Advantage. And you also see around the world cases where there's a public plan that people can decide to supplement with private insurance that's designed as an add-on, like you see in Medicare supplements in the US. Lots going on, and lots we can learn from thinking about Medicare.